What are the causes of heavy implantation bleeding during pregnancy?
Hello and welcome. Today we will discuss a pertinent issue related to early pregnancy, heavy implantation bleeding. This is an important topic for those trying to conceive or in their early stages of pregnancy, as it can sometimes be confused with a menstrual period.
What is implantation bleeding?
Implantation bleeding is a form of light spotting or bleeding that can occur around the time of implantation, when the fertilized egg attaches itself to the lining of the uterus. This usually occurs between 6 to 12 days after conception. Implantation bleeding is typically lighter and of a shorter duration than a regular menstrual period. It is often brown or pink in color, and its flow does not increase over time.
What causes heavy implantation bleeding?
Heavy implantation bleeding is not typical and is usually a sign of other conditions. If you experience heavy bleeding during the time of your expected implantation, it's important to rule out other causes such as 1. Miscarriage. Unfortunately, heavy bleeding could be a sign of an early miscarriage. However, it's essential not to jump to conclusions, and a healthcare provider should be contacted in such cases. 2. Ectopic pregnancy. This is a serious condition where the egg implants outside the uterus, typically in the fallopian tube. One of the signs of ectopic pregnancy could be heavy bleeding. 3. Molar pregnancy. A molar pregnancy is a rare condition in which abnormal tissue grows instead of an embryo. 4. Subchorionic hemorrhage. This is a condition where there is bleeding and collection of blood between the pregnancy membrane and the wall of the uterus. 5. Menstrual cycle. Sometimes, what appears to be heavy implantation bleeding might actually be the onset of your period. Remember, if you are experiencing heavy bleeding, contact your healthcare provider immediately.
How to differentiate heavy implantation bleeding from a period?
While both can result in bleeding, there are key differences. Implantation bleeding is generally lighter and lasts for a shorter duration, typically a few hours to a few days. It also tends to be pink or brown, not the bright or dark red that menstruation usually is. Pain, color, and duration of bleeding are key factors to consider. Always consult a healthcare provider if you're unsure. While light implantation bleeding can be a normal part of early pregnancy, heavy bleeding is typically not associated with implantation and should be evaluated by a healthcare provider. Remember, every individual and every pregnancy is unique, so what is normal can vary. If you're experiencing any form of heavy bleeding during pregnancy, it's essential to seek medical attention immediately. Thank you for joining us in this discussion. We hope this video has been helpful and informative. Stay healthy and safe.